is Healing of a Nation. My name is Eric Goepel, founder of the Veterans Cannabis Coalition. With me today is Shelly McKay, co-owner of Kannabis Works, a licensed dispensary in Southern California. But first, a quick word from our sponsors.
AeroBloom is a proprietary patent-pending aeroponic system that reliably achieves at least double the crop yield of hydroponic cultivation. AeroBloom also uses 40 to 90% less water than hydroponics or traditional farming practices and produces a higher quality harvest with one additional crop cycle per year. At over 4 pounds of AAA quality trimmed flower per light and one additional harvest per year, AeroBloom is the highest producing, most efficient cultivation system in the cannabis industry. To learn more about AeroBloom, please visit their website at aerobloom.com. And to learn more about their current investment opportunity, please visit the Wrazel investment marketplace at wrazel.com.
This is Healing of a Nation. With me again today is Shelly McKay. So Shelly, you're a co-owner of Kannabis Works, a licensed dispensary in Santa Ana, California. The only city in Orange County, a county of several million people, with licensed cannabis retail. I would love to hear more about, how you got to the point where you became one of the few licensed, owners and operators in a very restrictive area, and what's your intent with Kannabis Works as a dispensary is.
Sure. So just even the reason why I entered the cannabis space simply is for compassionate reasons. I had a dear friend in 2012 by the name of Eddie that was diagnosed with stage 4 esophageal cancer. And he had a couple of months to live. And so he decided to, along with treatment, take RSO. And I wasn't familiar with Rick Simpson oil, which is, now I know, it's a very concentrated form of oil. But he used this oil, and so his life was extended, past his diagnosis by 3 years. But the quality of life that he had was amazing. He was able to compete in some pretty grueling off-road races. And so I firsthand saw the benefit of cannabis just used in that situation to improve the remaining time he had. So then it came to a personal level with me where, I had a lot of different orthopedic injuries. In my 40s, it just started breaking down. Sure. And so I had quite a few surgeries. So I was on that, that medical, you go in for that visit, they give you a steroid injection, and then, it just eventually ends up steroids, painkillers, and then surgery. Right. So I had 5 surgeries in a period of 4 years.
Wow, that's which
was extensive. It was neck, shoulder, elbow. It was a lot. And so I had tremendous pain. And so when I saw the benefit of cannabis oil with Eddie, then I gave it a try. And I started using different ratioed oils, whether it was CBD rich or, THC at night for sleep and pain. And I was able to, one by one, knock off whatever pharmaceuticals I'd been taking. Then I stopped even using over-the-counter pain relievers. And I noticed a lot of great improvement in my health. Not only was I seeing the doctor far less, surgery stopped, and side effects. I was having I had no more stomach issues. So, I saw the benefits. So then I dove deep into the research of cannabis. So the past few years, I've been heavily studying the plant. So we had the opportunity with other partners. When Santa Ana announced that they were going to allow for medicinal dispensaries, it was just a matter of submitting a lottery ball, and we were one of the ones picked. But we were one of the last dispensaries to open. So we've been open since February of 2018. But knowing, and studying the plant and working with different clients with this oil, that's when we knew from the very beginning we wanted to open up and educate the public and use it as a tool for wellness. And we see it as a supplement for wellness. But, we see a lot of different people that come in every single day with different things they're looking to help, or whether it's just for fun or, just to relaxation or sleep.
Yeah, I think no matter where, whatever medicinal or adult use state I think you're talking about, the first point of contact customers and patients often have, are with, bud tenders or, store associates, and they often rely on those individuals to guide them to the kind of products that, that are going to meet the needs that they're looking for. And having I know Cannabis Works especially, takes the time to bring your sales staff up to speed about not just the selling points of individual products, but the overall chemistry of the plant and how different cannabinoids and different ratios are going to impact different conditions, as best as we understand it anyway.
Right.
A lot of what we all work with is, you could argue it's largely anecdotal, of course, but we understand that the things that we're seeing is at least backed by some level of research, even if it's not necessarily the highest quality. And more importantly, though, like, we see the results firsthand, right? You saw with Eddie the impact that using a full spectrum oil, along the Rick Simpson oil method, had on his quality of life as he dealt with a terminal case of cancer.
Right.
Right. And that's not something that, right, it's going to be hard to convince people otherwise, right? That that this was some unknown element that was having that effect, and it wasn't the cannabis oil itself. Right. So once you get involved in the cannabis industry, you're now operating one of the only licensed dispensaries in Orange County. You see a lot of different kinds of patients obviously come through your doors. What are some of the biggest medical complaints that people have, or what are they looking to cannabis to help them manage?
So I would say the top three would be sleep,
sure,
anxiety/depression, and pain. And quite frankly, there's a lot of people that because of the opiate crisis, they are looking to get to a different solution to help them with their pain or their or sleep issues. So we know that not only do we think that education is important and learning about this plant and staying on the current science, because it is being studied outside the United States. There are right. published studies. Tikkun Olam is one of those companies that's constantly publishing their findings, and they're showing that these different cannabinoids are effective for different health conditions. So here in the United States, it's still Schedule 1, and so we're barred. And but the research is happening outside sure. the United yeah. States. And yes, we are seeing quite a few patients that come to us, and it's not just they're coming straight to us, they're being referred to dispensaries. So we work with different doctors that, whether they're working with the senior population, they specialize in trying to get the seniors off of polypharmacy. And we have seen just through their protocols alone and the oils that they're sending their clients in for, they're microdosing with these substances, and they're able to, stop taking certain meds upon the advice of their doctor, of course. Right. But, and then we're also working with different groups that are sending in, children on the spectrum, or physicians like Dr. Bonnie Goldstein, who works with pediatric cancer and children on the spectrum. And, she's got a film out there, Weed the People. If anybody has not seen it yet, I encourage you to watch it. It is on Netflix, yeah. And but, it just shows the power of these cannabinoids. And, of course, it's pretty early. The endocannabinoid system wasn't really discovered until the late 80s, early 90s. So it's an early science. We've got a lot of groundwork to cover, but what we see in the dispensary, there's such a gap. There are cannabis clinicians that practice with cannabis, and they understand how it works with the endocannabinoid system, but there are many doctors that don't. They're not taught that in medical school. It's just now starting, but so there's a gap. And we know that there's a gap, and people are coming to us because they've heard, or a doctor says, try cannabis, but they don't necessarily know how to coach them or guide them. So, we do a lot of different things to increase awareness or education around cannabis. We certify our staff through a program called Healer, which is by Dr. Dustin Sulak, who is another cannabis clinician on the East Coast. But so that we just understand the benefits of these cannabinoids, but also their interactions with certain medications. And, to not tell someone that, I think, would be very ignorant, and, right. It's very important to to educate the client, to empower them to make a decision about their own health. You know,
and I've seen sometimes criticisms, leveled at dispensaries and the adult use commercial industry for not doing more to educate clientele on the different effects of cannabinoids and everything else. And often this is coming from doctors, which I find super rich, considering I don't think there's too many medical societies or medical colleges that ever delve significantly into the endocannabinoid system, which it's been called the most important neurotransmitter system in your body. And the fact that we are just essentially scratching the surface of it in the last 30 or 40 years, despite it being there, right? The understanding that the endocannabinoid system exists in I think all vertebrates or all mammals at least. So it's incredibly widespread, right? It basically you have two different types of receptors in your body that respond to these self-made cannabinoids, your endocannabinoids, which are produced by your body, anandamide and 2-AG, and those are the two dominant endocannabinoids that interact with the different receptors in your body. Now, the cannabinoids we find in plants, in cannabis specifically, THC and CBD being the two major workhorse molecules in the plant, those also interact with your bodily systems, right? So because they mimic the composition and molecular structure of your endocannabinoids, they bind to your receptors and they have effects, right? THC and CBD both modulate a variety of different bodily systems in a variety of different ways, and as well along with the other minor cannabinoids like CBG, and
THCA, CBDA,
of course, all the
THCV,
right, all the acidic precursors, all the A's and the varin subtypes, the V's. There's a lot of different cannabinoids. They all seem to have effects, and in addition, of course, you have terpenes, which are hydrocarbons found throughout the plant world, but which seemingly work in synergy with the other major cannabinoids, when you're consuming them all together.
Right.
So I mean, there's a lot there, right? And again, this is something that really should be robustly investigated, and you could spend billions of dollars over the next few decades, and I feel like we'd still only be part of the way there, and really unlocking how all of these things work individually and then work together, and then doing the testing and experimentation required to figure out like what the right combination, ingestion method, frequency of dosage to treat each individual person and and their specific conditions, because we understand too people react differently to different cannabinoids. Some people seem to react maybe more they feel like more anxious or more stressed out when they use THC, perhaps. They may be more sensitive to THC, or I don't know, too many people that are sensitive to CBD because it's pretty very innocuous as far as like a medical or a molecule that has like a medical effect.
Right.
But with all that we're talking about as far as the complexity of the plant and all the different ways that people can use it medicinally, we hit on a bigger picture, which is, in California especially, what started us on a path to legalization was Prop 215, the medicinal cannabis, right? The medicinal cannabis medicinal cannabis referendum passed in 1996, which created the medicinal cannabis market to a certain extent, in the state of California, and it was patients, led by advocates like Dennis Perone and Brownie Mary Rathbun, who were advocating on behalf of cancer and AIDS patients, particularly in the Greater Bay Area, and arguing that for these folks who were facing terminal illnesses like AIDS and cancer, especially 25 years ago, these were AIDS especially was far more deadly than it is today. They were arguing that these individuals, like all individuals who are facing degradation of quality of life, terminal chronic pain, they should have the right to use cannabis to alleviate those symptoms as much as they can. And that message of compassion ended up winning out, right? And it's what set California as a world leader in compassionate cannabis. Now, that has changed somewhat with the passage of adult use legalization in 2016 with Prop 64. And what we have seen, while there have been, I think, expansions like legal protections when it comes to, every adult in the state now is the legally protected right to grow 6 plants, for example.
Correct.
Right? That's a very big step, I think, in the right direction in terms of defining, making sure that let me try it again. I think Prop 64 did a good job of defining exactly the limits of the state in their ability to enforce the law against someone, growing or consuming cannabis, right? And creating a 6-plant limit, while it's very arbitrary, it does allow, I think, patients quite a bit of leeway in being able to grow their own medicine.
Right.
Which I think is basically the foundation for all this, that even if the legal industry disappeared tomorrow, people would still have the capacity to produce this medicine themselves.
Correct.
Although, of course, we understand that not everyone is in the position to grow their own. They don't have either the permission or the space or the extra time and money to do so. And so they rely on the legal industry for affordable and accessible medicine. With the passage of Prop 64, what we've been facing, from the patient perspective, has been an affordability and accessibility crisis.
Definitely.
Right. Legal prices have put cannabis out of reach of many patients who rely on cannabis as a medicine.
Simply because of the taxing structure.
And largely because of the tax structure, right? The cost that the state places on cannabis businesses is significant, and that cost basically gets passed down to the consumer or the patient. And while there are certain patient protections, there needs to be, I think, far more provision for the people who basically brought us to this point, right? The patients who were responsible for putting us on the path of legalization have largely been forgotten.
Correct.
Which is what prompted a group of advocates, Team Compassion, to work on a bill last year. Well, originally passed by the California State Legislature in 2018 before it was vetoed at the last minute by former Governor Jerry Brown. Mm-hmm. But SB 34, the Dennis Prohn and Brownie Mary Compassion Act, allows licensed California cannabis companies to donate donate cannabis products and essentially not incur state taxes. So under the previous arrangement, legal companies were disincentivized from donating product because they had to pay the full legal price on whatever they were trying to donate, which was at least, it's a few hundred % more than their cost of production, which limits in what individual businesses are able to donate, considering we're working on a pretty low margin
Correct.
Industry at the moment, considering the tax burden everybody's facing.
Right.
With SB 34, that was changed, and basically companies can now designate cannabis products for medicinal patients, and licensed retailers like Kannabis Works mm-hmm. can act as the point of distribution.
Right.
And essentially, and if you do what we've attempted to do in trying to set up a compassion program with Kannabis Works aimed at veterans, is if you can arrange down the line of production from the cultivator or the manufacturer through the distributor through the retailer, and basically get everybody on the same page and saying, listen, these are all these products coming, starting here and going through here and ending here, these are all marked and designated as being tagged for medicinal donations. And that way you can significantly bring down the burden on a dispensary or on any individual company in trying to come up with enough product to meet a pretty incessant demand.
Right.
So Cannabis Works, we have been working, I think, for over a year now, trying to figure out ways to educate and to ensure that veterans especially have access to medicine that they need. And Cannabis Works has been nice enough, or let's say generous enough, to dedicate your staff and put your own connections at the disposal of the community, and to bring companies into this to donate products, which I think is exemplary. And that's exactly the kind of arrangement and model that can be replicated throughout the state. Is it going to meet the demand from the patient community? No, of course not. Like there's charity is not a long-term solution to the issue of affordability and accessibility.
Right.
However, it is necessary, especially now when people are in a time where we're seeing massive unemployment and recession. Something like this in medicine can essentially be like a secondary a secondary purchase item after rent and food and all these other things.
Right.
And now people are, I think, hampering their ability to function as well as they used to, or they're now facing a lot more issues than they used to, because they no longer have as consistent access, because they can no longer afford it.
Right.
So let me just kind of rambled off here. Yeah, let me just reset real quick, and we'll I'm gonna figure out a better way to set up the Cannabis Works SB 34 question. Sorry.
It's all right.
Because I'm talking too much. All right. I wanted to bring the discussion back around to the SB 34 program that Veterans Cannabis Coalition has set up in partnership with Cannabis Works in Santa Ana. It's the first site of something that we hope to expand, to as many places as we can, especially in Southern California, where there is not much of a compassionate donation community, as exists in other parts of the state. So, the program with SB 34, I obviously know how it's set up, but I think it would be helpful for other folks in the industry, especially, and other licensees, to kind of get a sense of
Right.
what you've seen with it, as well as what you see as like the strengths and weaknesses, if there are any,
Okay.
in the program as it currently stands.
Yeah. So it was signed last October, and we were, I think, the first date we were able to hold an event was March 1st, and we did.
Okay.
So we had the event, but I simply reached out to the different vendors that make products for our store, and I said, would you be interested? SB 34 now allows for compassionate donation, and of course that's what Prop 215 was all about. And so, with the addition of SB 34, we knew we could donate products, so we reached out, and we got a pretty decent response back. So every month, it's we've got at least a handful, like 9 or 10 vendors now that are contributing product. So yes, it's tax free. There is a form that it's like the taxing. Hold on, I kind of screwed up. I forget the name of the form.
It's the CDTFA.
It's CDTFA. Yeah. And I'm trying to think where they could access it, because I was given to it by Tikkun.
I think they can get it. They can pull it from the CDTFA
Probably.
website.
CDTFA?
Yeah.
Okay. Yeah, but anyway, so it's a donation form that you fill out, and it's pretty basic. We keep paper formatted records right now because through our POS system that we use, of course we have Metric, which is the seed to sale tracking for the state of California. So that's kind of what we had to wait on, even in accepting donations legally,
Right.
Through Metric. So that's now in place, but then we keep careful, accurate records of everything that has been donated. But anybody that's in the program, whether it's a veteran program, it's compassionate donation for anybody that cannot afford, doesn't have access, but you need to have a medical recommendation as well. So and it's as simple as that, and so we hold monthly events. We try to anyway. During this time, it's been a little bit more difficult, but to where anybody that's enrolled in our program can come in and pick up their donation.
Right, and we've had, I think, over 40 veterans, maybe over 50 veterans.
Now we have 50.
So we've had
Total
over
of
50 veterans register and receive donations through this program. This is obviously, there's a lot more than 50 veterans in need, but we're trying to, I think, do our part to identify where the need exists within the community, and to be able to show that is an important part in advocating for change. It's one thing for advocates like ourselves to say, hey, we know these people and they need these things. It's a very different conversation when we can say, listen, come to these meetings, right? Talk to these people who are participating in this. Hear from other people other than us. Right. What the issues at play are.
Right.
And I think that's far more powerful, often even than a well-crafted message, because I think it grounds the issue in a much more real way in people's lives when they hear from just not professionals
right.
about how this is making a positive impact. And we've talked about affordability and accessibility, right? Affordability in terms of the overall cost of medicine and of cannabis products, and accessibility in terms of, like, in Orange County, Santa Ana is the only city that allows retail. There are places that allow for delivery, but it is pretty sparsely covered as far as let's say easy access within 10, 15 miles of there's not really much available.
Which to me translates, it doesn't allow for safe access for everyone. If you've only got certain cities that are allowing for cannabis retail, and it's legal in the state of California, I think the misconception is that because cannabis is legal, people think they show up at any store in California where they sell cannabis and that it's okay, and there's a big difference, clean and tested products versus non. So, we need more retail. We need more dispensaries in the state of California. There's not enough to support the millions of people that live here that want access, that voted for access. So, you're barring like safe access to a clean product. Yes, I know it's overtaxed a bit. Certain cities are more than others.
Sure.
I mean, we're at a total of 31% in Santa Ana. I was out at Palm Desert. I went through the harbor side. They had a little drive-through dispensary, and their taxing structure is 37%. And nothing is taxed like that. I mean,
it is, yeah.
There needs to be change, but.
And I think that's maybe that's a big issue there, is like this sort of what I call like cannabis exceptionalism, right? You're treating cannabis as an exceptional product in some way, unlike anything else that's comparable to it. You're not treating it like pharmaceutical drugs. You're not treating it like over-the-counter medications. You're not treating it like alcohol. You're not treating it like tobacco. You're treating it in a completely different way, and the requirements that are put in place, and obviously the tax issues that are that businesses are facing, all of these basically make it very difficult to compete. The localities being able to control whether or not they license retail or other kinds of cannabis businesses, makes it also very difficult to compete, because you're always competing over very limited numbers of licenses.
Right.
Now, I'm sure there's a lot of folks in the industry that don't necessarily want a dispensary on every street corner, right? Because we don't really know what the limit or what the capacity for dispensaries are in the state, because it's been so held back for so long.
Right.
It's hard to really say what the true market looks like, because only a third of it exists in the legal space. So there's still a lot of money, exchanging hands in terms of cannabis in California, but so little of it the state sees. So it's very difficult. I think it's kind of hard for us to say with any kind of definitive. It's hard for us to say in any definitive way exactly like how big, what people are consuming, how they consume it. But ultimately, it's going to continue on whether or not the state licenses new retail, or
Right.
localities license new retail, or it continues to stay in the illicit market, people will continue to grow and find and source and buy cannabis. And sort of the question becomes, it's like, how much is the government going to allow the market to sort of slip away? And it's never going to be able to claim anywhere close to the majority of it until it gets closer to what the illicit market is charging.
Correct.
And a lot of it's, if you're looking at cannabis as a revenue generator, I think if you're looking at it as cannabis as a revenue generator, you're looking at it wrong.
Correct.
Right. It should be a way to reduce your other costs, not so much bring fill gaps in your budget.
Shady Creek Trading Company produces and distributes cannabis-infused wild meat jerky products. Co-created by Settlers Jerky founder, Shady Creek Trading Company is an infused jerky products and distribution corporation located in Nevada City, California. Nomad Jerky Bites is their premier product, a packaged pouch with hearty bites of ethically raised buffalo fortified with THC. Shady Creek Trading Company are the innovators of the infused meat jerky market. They are compliant by all FDA standards and use cured strips of real buffalo as opposed to pressed jerky. To learn more about Shady Creek and their current investment opportunity, please visit the Wrazel investment marketplace at wrazel.com.
So I wanted to leave with a final question. I know that you're working with the Last Prisoner Project now, and that you're supporting their work through the dispensary itself. I'd love to hear more about how how you're working on that.
Yeah, so starting August 1st, we will be accepting donations for Last Prisoners Project. And the Last Prisoners Project was started last year by the D'Angelo brothers. They have Harborside Dispensary in Oakland, California. They've got a few more throughout the state, but incredible advocates and activists that started this program as a way to help decarcerate nonviolent cannabis offenders, people that have been, even. Hold on, let me back up there. Last Prisoners Project. Hold on, I lost my train of thought.
I'm affecting you.
Yeah. So I think we got 5 minutes. Okay. So Last Prisoners Project is an important we need to decarcerate. We need to free every last prisoner that is in prison for a nonviolent cannabis crime. Simply because here we are, however many years later now, making money and profiting off of cannabis, and they are jailed for the very same thing. So I in good conscience, I don't agree with that. I sat as a federal court reporter for many, many years, sitting and listening and taking down these drug trials, and it just seemed like such an innocuous crime to me. I now see, after studying this plant for so many years, that I consider it to be medicine. I consider it to be something that we have a human right to access. And the fact that we have so many people still in jail for cannabis is it's appalling to me. So we're here to support that. We want to support not only clemency, but they also support reentry, and they do training and education. So I would strongly urge anybody to please support that program as well.
I think it's important to note that in pursuing the end of cannabis prohibition as a movement, that we're also supporting the restoration of those that were harmed by the drug war.
Definitely.
And by cannabis prohibition specifically.
Definitely.
And I think in part of that, this movement toward restoration, it's the reentry, it's expungement, it's ensuring that no one is going into prison again, or or serving in jail because of a cannabis crime, and that the people who are currently in jail and prison are out. And I think until we hit that, we're never going to really realize what legalization is until we free all the prisoners of a very corrupt state institution that prohibition represents. So thank you again, Shelly. I appreciate you taking the time, and thank you again for continued dedication to both patients and consumers and ensuring that they have the best understanding and the best access possible to an important medicine. This is Healing of a Nation. My name is Eric Goepel, and thank you for joining us.